Today on Investigate TV Plus, body cameras bring transparency to policing. I'm Lee Zurich.
And I'm Tisha Powell. Our investigations uncovered situations caught on camera, including ethical dilemmas.
Am I right in my warning?
I'm not sure.
Hey, just tell him that he owes us free or something.
And incorrectly identified medical emergencies.
How much have you had to drink today?
We examine how this critical tool holds some agencies accountable.
You're going to be going to jail right now for DUI, okay?
I'm not DUI.
You're extremely DUI. You can't even stand up.
Plus, cybercriminals target schools and hospitals in a scheme that can cost more than money.
Are people's lives at risk?
They're absolutely at risk.
We explore how these attacks can have far-reaching consequences and strategies to protect your data.
Then,
1, 2, 3, baseball!
a league of their own.
Like it has helped him grow very much in like the confidence and self-esteem.
We take you to the field of dreams where you'll find proof baseball is for everyone.
In-depth stories that inform and inspire. You're watching Investigate TV Plus.
Over the last 2 decades, a tiny device has transformed the way people interact with police.
The first police body-worn cameras appeared in the U.S. in 2012 in Arizona and California.
In 2014, the federal government announced a plan to help local agencies adopt the new tool. The decision came in the wake of protests calling for police accountability following the fatal police shooting of Michael Brown in Ferguson, Missouri.
By 2016, nearly half of all law enforcement agencies use body cameras. As of 2020, use was at 79%.
Today, we'll bring you 2 investigations where body cameras played a critical role in telling the full story.
We begin in southeastern Tennessee, where a former sheriff's deputy says he was arrested for driving under the influence while he was actually suffering from a medical emergency.
Reporter Jeremy Finley has the story.
We're getting a lot of calls about your driving. You're all over the roadway.
It's not so much what he says.
So then how come you're driving all over the roadway?
But what Dean Binkley doesn't say that indicates something is very wrong.
I don't remember anything.
I'm telling you, man, I've never seen anybody drive like this.
A driver describes how Binkley was driving erratically on Rutledge Ford Road in Franklin County.
He was going all the way up there and he was going all the way across.
Trooper Ryan Nichols responds.
How much have you had to drink today?
Drink?
Alcohol.
But Binkley also doesn't respond to other questions
You good?
and stumbles.
Do you know where you're at right now?
Somewhere between,
What have you taken today?
medication,
What kind of medication?
diabetes medication.
Moments later, it is clear Binkley is in no shape to drive.
You're going to be going to jail right now for DUI, okay?
I'm not DUI.
You're extremely DUI. You can't even stand up.
But even Nichols questions, what's wrong with him?
I don't know what to do now. I'm confused.
Confused because of what Binkley says once he's under arrest.
I need sugar.
You need sugar?
Yes.
Are you low on sugar?
Yes.
Turns out Binkley was coming home from his doctor when his blood sugar levels crashed.
What's it like when your sugar gets that low?
I'm just like I'm drunk.
It's something that paramedics confirm can happen to diabetics who are low on sugar.
Because it'll mimic a stroke, forgetfulness, slurred speech, all of that.
Once again, Nichols questions what he should do.
But I haven't dealt with something like this yet, so I don't know if I don't want to make a bad call when he just needs medical treatment.
Binkley believes the call should have been clear because, like Nichols, he's not only arrested drunk drivers while working as a sheriff's deputy.
So how many DUI arrests do you think that you've made?
Oh, in my career, 100 or plus.
But he was also educated on how to respond to diabetics.
I went through the academy when I was 21-year-old. I was taught dealing with diabetics then.
I have not.
And even after paramedics discover that Binkley's blood sugar was dangerously low, Nichols talks to his lieutenant on the phone and tells Binkley his decision.
I think you're under the influence of a drug, of narcotic. No. Because your pupils are constricted, which is signs that you have an active narcotic.
And also makes this comment to another officer.
I mean, if it is medical, then he can prove all that in court. And I don't care to lose a court case.
It meant the former deputy then had a mugshot for everyone to see. A cloud of suspicion he lived under for 7 months until his blood work came back and the charges dismissed. The order reading, no substances were shown in the defendant's system.
What's it been like to go through this when you're law enforcement yourself?
Quite embarrassing. Quite embarrassing.
In August of 2025, just over a year after the arrest, Binkley filed a federal lawsuit against Trooper Nichols. He joins a growing list of drivers who claim they were wrongfully arrested for DUI, pursuing legal action against Tennessee state troopers. Now, we reached out to the Tennessee Highway Patrol for comment. We have not received a response. In Nashville, I'm Jeremy Finley.
In Tennessee's neighboring state of Georgia, a police department was forced to change its policy regarding traffic citations after a body camera captured conduct city leaders called unacceptable.
Investigative reporter Brennan Keefe shows us how the incident unfolded.
A Jefferson police officer pulls over a pickup truck not knowing who was behind the wheel.
Good afternoon, I'm Officer Redmond, Jefferson Police Department. Got your license on your boss? Must be new. Say what? Must be new. Me? The reason I stopped you, you were on your cell phone back there at the light. They're getting off the interstate back there, all right? All right, sit tight for me.
The driver, Stacy Blanton, wasn't done with his phone. Records obtained by Atlanta News First Investigates show the driver immediately called the cell phone of Police Chief Stephen Bannister, while Officer Jordan Redmond was in the squad car running Blanton's license. Within a minute, the chief called Officer Redmond.
Yes, sir.
You got our old man pulled over?
Who's that?
Stacy Blanton.
Yeah, who is Mr. Blanton?
Run, the guy changes all up there quickly.
Yes, sir, I got him pulled over.
You mind writing him a warning?
I'm not sure.
He's black. Don't get me wrong, he can be a black when he wants to. He gets us a heck of a deal to service our cars. We get it done cheaper there and do everywhere else.
Officer Redmond pauses in silence for a moment, then...
All right.
Hey, just tell him that he owes us some free oil changes.
All right, then.
Will the officer really issue a warning instead of a ticket for the driver owing some free oil changes? The answer is no.
Hi, boss man. So I'm going to issue a citation today for your cell phone. You have two options. You have a court date on the front of your copy. You also got a what? College? Excuse me? Your chief just called? I spoke with my chief. So you have a court date on your copy. You also have a website and phone number. He didn't say anything to you. That is a private phone call, sir. I know. So your court date's going to be on the front. The website and phone number is going to be right here on the back for you.
City cell phone records show the driver immediately called the chief back. We don't know what was said in that 2-minute call, but Chief Bannister then dialed Officer Redmond's phone, a call that lasted 7 minutes. Here's the citation. Records show Blanton paid the $50 fine in September without admitting guilt.
You drive safely, sir.
3 weeks after the stop, the city manager issued this formal reprimand to the chief for inappropriate interference. Your actions directly violate the principles of operational integrity and impartial law enforcement, the city manager wrote, adding that the chief undermined the authority and discretion of the on-duty officer, created a perception of preferential treatment, and risked public confidence in the fairness and impartiality of the police department. The city manager called the chief's conduct unacceptable, but did not demote him or issue any punishment. The city manager ordered the chief to draft a new policy to prevent him and other officers from doing what he already did.
You mind writing him a warning? Just tell him that he owes us some free oil changes.
The new policy memo is titled Prohibition on Request for Preferential Treatment Regarding Traffic Citations/Warnings, and it prevents officers from requesting that another officer issue a written warning in lieu of a formal citation. Officers are directed to decide on their own, fairly and without bias. We reached out to the interim police chief, then Mayor John Howell, who's since been voted out of office, Stacy Blanton, the driver in this case, and the officer involved. None of them responded to our requests for interviews. In Atlanta, I'm Brendan Keefe.
Still ahead, a new treatment gives some cancer patients hope for the future.
I just can't even fathom. I really can't. It would change my life.
We explain how the breakthrough therapy works.
But first, guarding your online data has never been more important.
We have the power to protect ourselves to the degree that we take control of some things.
We examine a costly cybercrime that puts your privacy on the line and what you can do right now to better protect your personal information.
Our in-depth coverage continues. You can get connected to Investigate TV Plus on all social media platforms.
It's an evolving threat putting people's privacy and well-being at risk, and it typically starts with a simple click.
A ransomware attack begins when a user downloads malware by clicking on a phishing email or following a suspicious link. From there, the malware allows cybercriminals to lock users out of accounts and hold sensitive information hostage in exchange for money.
One industry hit particularly hard is healthcare. Between 2022 and 2023, the average data breach cost hospitals almost $10 million. This doesn't just put patient privacy at risk.
Experts tell us these attacks can disrupt internet connections, adding precious time when seconds matter to save lives.
Are people's lives at risk?
They're absolutely at risk. The devices may still work, but for instance, a CT scanner may not be able to transmit the image of a stroke patient to a remote radiologist or to the operating room.
It's why, whether you're at work or home, experts say safely staying connected has never been more important.
Reporter Carice Jackman examines the far-reaching impact of these cyber attacks and reveals strategies to protect your data.
Cybersecurity is incredibly important because it is the one thing that can make connectivity inaccessible. So this is called the Network Operations Center.
Tracy Dokes is president and CEO of MCNC, a nonprofit broadband provider that operates more than 5,000 miles of fiber across North Carolina, serving K-12 schools, community colleges, libraries, and other institutions.
This is where all of that kind of monitoring happens.
She knows firsthand how broadband powers critical services, keeping students connected in classrooms and supporting care teams inside hospitals.
When we had COVID, we had more ransomware attacks than we had ever seen, and most of them were happening at the most vulnerable anchor institutions that we had, like community colleges, like K-12 schools.
And Dokes says cybersecurity is just as crucial for individual consumers.
When we're talking about a patient that's trying to use telehealth with their provider, they're going to need to know that the machine that they're using is secure, because that's our healthcare data.
According to the Identity Theft Resource Center, cyber attacks drove most data breaches in the first quarter of 2025. More than 1,300 incidents affecting 114 million people, with financial aid and healthcare sectors hit the hardest. Kathy Stokes with AARP says consumers must take steps to protect themselves.
Like making sure that we're using a password manager. When you have the opportunity to establish that second-level multi-factor authentication, sign up for it.
To combat cyber attacks, MCNC created Vital Cyber Consulting, which helps institutions with risk assessments, security strategies, and alerts systems to defend against bad actors. Experts say if you believe your data or devices have been compromised, you should update your software, change passwords, and monitor your credit for any unusual activity.
Still ahead, one team is ahead of the game when it comes to helping kids access America's pastime.
Here at the Miracle League field, everyone can be themselves.
We take you to the baseball field, giving all players a chance at bat.
But first, doctors say an emerging cancer treatment is helping patients live longer and fuller lives.
These types of therapies have been revolutionizing the way we treat multiple myeloma.
We explain how it harnesses the body's own power to fight off the deadly disease. Nearly 200,000 people in the United States live with a cancer diagnosis of multiple myeloma. It's when a type of white blood cell grows out of control, causing low blood counts, bone and calcium problems, frequent infections, and kidney damage. According to the American Cancer Society, when traditional chemotherapy doesn't work, one treatment uses genetically modified cells to fight off the cancer.
It's called CAR T-cell therapy. In 2024, in order to increase patient access, the FDA eliminated some barriers to that care. Since then, one type of this therapy has seen promising results.
Reporter Michaela Marshall spoke with one Arizona woman who says it changed her life.
I trust God with my life and with what He has in His plans for me, and so that gave me a sense of peace, but it's still a scary thing.
It's been a decade since Susan Lehman was diagnosed with multiple myeloma. The rare type of blood cancer develops in plasma cells in bone marrow.
It's treatable, but it's not curable.
Over the years, the 60-year-old mother of 4 has been in and out of remission. She's undergone 2 stem cell transplants and a slew of other treatments. Then in March, her oncologist, Banner Health Dr. Sumit Madan, had her try something new, Carvykti.
These types of therapies have been revolutionizing the way we treat multiple myeloma now.
Just 2 months in, Susan says the immunotherapy has made a big difference.
Since then, I'm back out hiking.
Carvykti is an option for multiple myeloma patients when traditional cancer treatments are no longer effective.
It utilizes the patient's own immune cells to act against the cancer cells.
It's been approved for 3 years, but new longer-term data from a study shows Carvykti doesn't just slow down the progression of the disease. It helps patients live a lot longer.
Historically, the outcome of these patients is pretty poor, with an average survival of under a year.
It's being hailed as a major medical breakthrough, even a possible cure.
If you look at the average age of when a patient with multiple myeloma is diagnosed, they're about 70 years. And so if I'm able to keep that patient alive for the next 10 to 15 years and they're not dying from their cancer, then to me it is a cure.
And the words cure and cancer in the same sentence encourages patients like Susan to keep fighting.
I just can't even fathom. I really can't. It would change my life.
According to Carvykti's website, the process involves collecting, genetically modifying, then reinfusing white blood cells to attack the cancer. One treatment takes about 2 to 3 months to complete.
Still ahead.
It's my favorite sport and I like having fun.
Building confidence through baseball.
I'm just so proud of him, just the accomplishments, just seeing him light up.
We take you to the field where one league offers a home run experience for children with disabilities. According to Move United, which offers more than 70 adaptive sports, many traditional and club-based sports lack the resources to effectively include children with disabilities, which leaves families reliant on nonprofits to fill the void.
A league in Charlotte, North Carolina is proof sports, and in this case, baseball, can be for everyone.
Reporter Dedrick Russell introduces us to the team that players and parents call a grand slam.
1, 2, 3, baseball!
Every time these players hit the field, it's a home run, especially for Tommy Love.
Because I like hitting the ball so hard.
And Graham Hedrick.
You can swing in any direction. I like to swing right hand and then you just step and swing.
They both met at Miracle Baseball League, a league where they can be themselves. They both have autism. They come to the Keith Family YMCA twice a week.
So I can get better.
It's my favorite sport and I like having fun and I like hitting, I like having fun defending, and I like catching balls, playing third base.
Terry Love is Tommy's mother.
Eats, sleeps, breathes, dreams baseball.
Tommy joined the Miracle League 3 years ago.
Like it has helped him grow very much in like the confidence and self-esteem. Like he hit a home run this past Saturday over the fence.
And that home run made him feel
great.
Graham came on the team about a year ago. Lydia McGinnis is the Association Director of Adaptive Programming.
Here at the Miracle League field, everyone can be themselves. Everyone can just truly show exactly who they are in a sense of belonging.
About 100 players make up this Miracle League, a league where players are safe and they can give it all they got.
We've even seen kids that have a walker for a mobility aid, and then they'll go from home to first, and they'll drop their walker and like either crawl or like walk towards first base. And it's just so cool to see that happen here. And I get misty-eyed all the time at game days.
It takes about $100,000 a year to run this program. The charge is $35. The goal is to keep costs low so all can participate.
These families also have so many other costs that are associated with having a disability, so we want to make sure that we are an equitable program and an accessible program so that everyone can participate.
I think Miracle League's the best.
I'm just so proud of him, just the accomplishments, just seeing him light up. You know, as a mom, it just, you know, brings so much joy to my heart, honestly. It's a miracle. It's a Miracle League for sure.
What a great idea to get those kids out there enjoying the outdoors, playing baseball, learning a sport.
Yeah, and they all have some pretty good skills. I saw some pretty good swings out there.
Yep, one of them hit a home run.
Baseball is for everyone. Yes. And that's it for us on Investigate TV Plus. I'm Tisha Powell.
And I'm Lee Zurich. Thanks for watching. On the next Investigate TV Plus, some states are collecting millions by selling driver's data to private investigators and tow truck companies.
I think that's something that we as victims or we as people should be able to have some control over.
We'll break down how a 30-year-old federal law makes it possible and if there's anything you can do to protect your personal information.